And I'm also going to be recording. Okay, great. I think we're good. Leah, if you see it, yeah, I think we're good. Okay, so I'm going to share my screen and get our class started. Thank you for those who are joining us via Zoom. This is one of my favorite classes. Oh, I see what I have to do. Hold on, I have to click OK. Hold on, let me stop the share. I just realized I have to click OK. Supporting the system naturally. Yes, go live. Okay, now we should be live in Facebook. Okay, great. Got it. All these buttons to click. Thank you for being patient. We have internet here, so that is wonderful. Okay, I'm going to share my screen so we can get started. Like I was saying, this is one of my favorite classes. I've taught this one a couple times and I added to it. So it keeps evolving, which is exciting. So today's class is going to be on supporting the lymphatic system naturally. So before we get started, of course, we have to understand that this information presented in the webinar is for informational and educational purposes only and does not constitute medical, psychological, or health advice, and does not establish any kind of therapist-client relationship. So let's start out. For those of you who don't know me, I'm Tracy Podolsky. I'm a physical therapist, lymphedema therapist. I partnered with doTERRA in 2017, made some pretty big health changes myself. Starting 2018, it's always a journey, as we will see throughout this class as well. And that led me to become a student of the Institute for Functional Medicine in 2019, which I am absolutely loving. And I'm loving the shift in my practice that I have undergone, which I'll talk about in a second. And here's my picture from yesterday. I threw in a Halloween photo. I was a ninja. My older son was this blow up dino, which all the little kids loved. My little guy was Venom. And there's my little niece, who is a little mermaid. Such a great day yesterday. And we can't go any farther without introducing Dr. Cherie again. She is a physician. She is a breast cancer survivor and a lymphedema patient. She is the founder of the Live Today Foundation, and all of us are collaborating. So Dr. Cherie and I collaborated with doTERRA in order to present these classes as well as raise money. So I'm going to play the video that will give us a little background on how doTERRA is going to be helping us with this amazing fundraiser.
The culture of doTERRA really begins through the desire to give, help, liberate, and empower others, and they do so through the doTERRA Healing Hands Foundation. From the very beginning, doTERRA's founding executives had the vision of bringing healing and hope to the world through providing global communities with the tools needed to become self-reliant, empowering individuals, and changing lives. Their desire and commitment to establish a pattern of giving carries forward. Tracy Podolsky is a physical therapist, lymphedema therapist, and a doTERRA wellness advocate who has a passion to empower those who have a history of cancer and lymphedema. In today's world, there are so many natural solutions to support the body, mind, and spirit that go well beyond the weeks and months of a cancer diagnosis. Together with myself, Dr. Cherie Prentice, founder of the Live Today Foundation, Tracy is fundraising through doTERRA's Match program in order to provide 200 women and men with free compression garments and to provide the necessary education to both clinicians and patients on lymphedema awareness, treatment, and prevention. We thank you for tuning in and actively engaging in the doTERRA Healing Hands Foundation's generous support of the Live Today Foundation's goal of raising $10,600, which doTERRA will match dollar per dollar. With your donation of any amount and the purchase of any oils, you can join the Live Today movement and be assured that you are receiving only the highest quality and purest essential oils, only the best to promote health and wellness for you and your loved ones. Thank you so much for your generosity.
Really great about this is that not only are we 61%,
The culture of
we're not only 61% there already towards our goal, is that we also have 30 days left. So we appreciate any one of you who are listening to this. Share the link. Most people have been touched by a cancer diagnosis, whether it was personally or through someone in their family. So please reach out. We also are really loving that we're being able to spread awareness on prevention of lymphedema. So during this class, I didn't want to deflect too much on the topic. So I decided that I will be going live within the next week or two on the Wyatt Rehab page, because I'd really like to share with impacted by lymphedema, or someone who might be impacted recently with a cancer diagnosis or cancer-related surgeries, that preventing lymphedema is possible with the use of a device that we call SOZO. It's bioimpedance device. So I will be going over that in a different class. So if you're interested in learning more about that, please go to our Wyatt page and like it so that you will be able to see when we go over that information. So moving forward, our fundraiser was just so perfectly aligned with where my practice is shifting. So as a conventional lymphedema therapist, I have now evolved into the functional space. And I can't be more grateful to doTERRA, who originally introduced me to overall foundational health, which then led me to the Institute for Functional Medicine. And last week, just as a review, or if you didn't, if you weren't able to attend last week, you can always go on the Wyatt Rehab Facebook page and look at the class from last week, which we went into a little bit more depth of the functional medicine tree. But remember, our conventional medicine is just as important, but we also need to combine it with functional medicine. Conventional medicine is our traditional healthcare model. It's a symptom-based model, and they have very broad protocols. When we look at functional medicine, functional practitioners look at how and why illness occurs, and we want to restore health by using the roots of the tree. So remember, we went over these 5 roots, and you're going to see some parallels, because today I'm going to be going over the doTERRA wellness pyramid, which is very similar. If you look at sleep and relaxation, exercise and movement, nutrition, stress, and then what doTERRA does not have on their pyramid, but almost goes hand in hand when you become part of the doTERRA family, either as a customer or a wellness advocate, relationships. Relationships is so key. Whether they're toxic or whether they're healthy relationships, they have an impact on our health. So when I think about me as a lymphedema therapist, I've always been practicing conventional lymphedema therapy. And that basically is, you come in with the sign and symptom of swelling, and you are diagnosed with lymphedema, and we provide good, complete decongestive therapy, which includes the bandaging, the manual lymph drainage, the garments, the self-care education, and then of course, follow up afterwards to make sure that you're doing that properly, and that you have all the tools you need to manage the stage 2 or stage 3 lymphedema. That is conventional lymphedema therapy, but I believe that everyone should be part of a functional model as well. So what I'm introducing to patients that are already in self-care is working on lifestyle changes. And for the past 4 to 5 years, I've been doing that, not formally, but informally, talking about the roots of the tree: your sleep, your relaxation, your stress management, your movement, your nutrition. And lo and behold, for the first time ever, I've been able to watch people's bodies change, watch them heal, and watch them get healthier so that they can actually remove some of their compression, or maybe not use them as much, or there's a whole plethora of things that open up. And I'm continuing to see this anecdotally, which makes me so intrigued about not only the diagnosis of lymphedema, but with all of us, no matter what brought you to this webinar, what what is it in your life that you can make some lifestyle shifts in order to get healthier from the inside out? Because overall, we're in an epidemic of chronic inflammation. So we know that even if you're at risk for developing lymphedema, if you're systemically inflamed, or you have food sensitivities, or you have a really toxic work environment, those can all be triggers to cause the lymphedema to not manage as well and have some, you need many more tools in your toolbox in order to manage it. So what I like to do, some people say, well, I don't really know where to start. So I usually give my patients now a vitality assessment, which is a quick little questionnaire on each of the areas that we're going to go over tonight on the doTERRA wellness lifestyle pyramid. So we want to look at those areas of eating right, exercising, resting and managing stress, and reducing your toxic load. So before we go into how we do that with anyone, whether you have a risk of developing lymphedema, whether you have lymphedema, or whether you have a normally functioning lymphatic system, we have to really understand what our lymphatic system does. So this is a picture I use often, and excuse me, it shows the superficial and the deep lymphatic system. So what does the lymphatic system do? The two main things I want you to go home with today is that it absolutely plays a huge function in eliminating toxins and wastes from our body. And the second thing is it plays a major role in our immune function. So all of us have lymphatic systems. I usually like to describe it as looking at it in 6 different quadrants. So when you look at the superficial lymphatic system, you can kind of see this brown delineation down the right and left side of the body that delineates right from left. And then you have these other lines up near the collarbone that separates the head and neck from the upper quadrants, and then one right at the belly button that separates the lower and upper quadrants. So when we look at this, each one of these 6 quadrants has a major lymph node group that limb and body area drain to. So for example, your right axillary lymph nodes, or the lymph nodes in your armpit, drain the entire arm and the entire front and back of your chest wall. Okay, so same thing with the head and neck. You have lymph nodes in each side of your neck that drain that side of the head and neck. And then you have lymph nodes in your groin that drain the right and left leg, as well as everything below the abdomen. So each area gets their own lymph node bed to help filter all sorts of toxins and wastes that we don't need. So think about when you have a common cold or a respiratory infection, our lymph nodes swell. That is a normal response because the lymph nodes are getting rid of and helping your immune system out by getting rid of that virus or that cold. So that's why those lymph nodes swell. That's a sign that something's going on in your immune system. So when we have cancer, we typically need to remove lymph nodes if the cancer has spread into the lymph node bed. But the problem with that is that we're removing part of the lymphatic system. And what's even more complicating is if you have radiation to the area. So very commonly, breast cancer, we would remove lymph nodes as well as radiate the trunk area, and that damages lymphatics. So think about lymphatics as your sewage system. A bunch of vessels. Everywhere you have skin, you have lymphatic vessels that are absorbing the fluid in that tissue space and bringing it to the lymph nodes so that the lymph nodes can filter it. And then after each quadrant takes on the toxins and wastes, it goes into the deep system. This dark green area in the center of your body is deep within all of your organs, and it penetrates the diaphragm. And then it eventually dumps and meets your bloodstream up here at the venous angles. Okay, so the lymphatic system is separate from your bloodstream, but they do connect up here at the neck. So basically, anything that your lymphatic system is getting rid of, it's going to dump it back into your bloodstream, and then the bloodstream filters it, and you're eventually going to excrete it. So we have to think about, well, how are we excreting toxins? It's either from your skin, which is sweat, or even think about rashes. I want you to keep that in mind as well. When you have something on your skin, that's a way our body can eliminate things. But most commonly urine and bowel movements. So your bladder and your gut need to be functioning properly, because if your lymphatic system is doing its job and you are not having 2 to 3 bowel movements a day, what's happening with all of the toxins that your organs and your lymphatic system are getting rid of? You're not being able to excrete it. So what's really important is to really think about yourself and your own health, and do I sweat? Do I have normal bowel movements? Do I go to the bathroom a lot? Do I urinate a lot? A lot of my patients, because when we shift fluid, they have to urinate more. I always try to shift the mindset. That's a good thing. We want to be grateful every time we eliminate toxins and wastes. So then the next question is, now that we understand a little bit more about what the lymphatic system does, now we need to understand those that have lymphedema and those that might be at risk for developing lymphedema. So there are 2 types of lymphedema, primary and secondary. Primary lymphedema is when you're born with a lymphatic compromise. So let's say that system right here didn't develop properly. Maybe you have less lymph nodes than normal. Maybe the lymphatic vessels are entangled with blood vessels. That doesn't allow the lymphatic system to function properly. So you will see swelling at some point in your life, but without any known cause, usually at birth. And if not, the second most common primary time for swelling to occur is during puberty. But we have even seen people that are diagnosed with primary lymphedema after their 30s. So it's very common for people to have a swelling when it's primary within the first 20 years of their life. But secondary lymphedema is when you're born with a normally functioning lymphatic system, but now there's insult or damage to the normally functioning lymphatic system. So that can be very commonly, as we're talking about right now, cancer surgery and treatment, where you're actually disrupting and injuring the normal lymphatic system. It can be with vein disease or infections like cellulitis. I've had people with multiple surgeries or traumas to the limb where the damage is occurring and the scar tissue is laying down, impeding those superficial lymphatics to drain. Obesity is something as well, and mainly because you're putting so much pressure on the venous system that the veins leak out water, which is it's not lymph, but what happens is the lymphatic system kicks in like a sump pump. And when you have vein disease or obesity, you have retention of fluid, of just water, or water leaks out from the veins, and your lymphatic system tries to help out and kicks in. But over months and years of that, the lymphatic system just gets extremely exhausted. And so then you develop something called phlebolymphedema. Another condition called lipedema can cause lymphedema. And another one that I'm throwing on there, and only because of my anecdotal experience over the years, there are people more recently that I evaluate and I take their history, and they don't have primary and they don't have any clear secondary insult. But when you look at their deeper, looking deep within what's going on in their environment and what their lifestyle is, and maybe considering their epigenetic variations, I believe that we should be putting overload of toxins in the body as a cause for lymphedema. And it makes sense to me. And I see these patients that are not really fitting the normal criterion, but that makes sense to me. And now understanding what the lymphatic system does, what we're surrounded by today, maybe not 30, 40, 50 years ago, but today we are in a toxic soup, right? So we need to learn how to support our lymphatic system, because that is one of the biggest parts of our body that is going to help us get rid of what we're either breathing in, applying, or ingesting. So immune boosting lymphatic control is actually within our control, but we need to understand this pyramid, or you can always refer to the functional medicine tree where the roots are. but they're very similar. As you can see, eating right, exercising, resting and managing stress, and reducing your toxic load. That should be where you're looking at lifestyle changes. Then you look at, functional healthcare. I look at labeling this functional healthcare is having good informed self-care. Well, what does that mean? For example, you being on this webinar is something you chose to do to inform yourself on how to take care of yourself better. That's being informed. That's practicing good self-care. The other thing is proactive medical care, going to the doctor when you're not broken. I mean, still going to the doctor when something's wrong, but going to the doctor once a year, twice a year, getting involved with a functional practitioner to really understand your individual body to help you make these changes within your lifestyle. Then we go back to last week. We talked about the AAA, aware, assess, and action. So we talked about it in strengthening your mindset, but we also want to be aware of our lifestyle, assess our lifestyle, and then we can create action. So we're going to go through the areas of the lifestyle in terms of lymphatic health. Look at this picture. This is exactly what I showed you last week, but it's exactly true for lymphatic health as well. So you want to be eating all of your organic veggies and fruits, clean meat, wild caught fish, healthy fats, and supplementation where you need. Clean water with your essential oils. Your citrus essential oils are really going to help cleanse the body and assist your lymphatic system in cleansing as well. And herbal tea. We want to be reducing all of these on this side. Sugar. Sugar is going to feed cancer. It's going to feed and inflame the lymphatic system. Refined carbohydrates, all your processed foods, gluten, dairy, coffee, and alcohol. So all of these are general recommendations. If you remember last week, I said that there are reasons why people should have individualized food plans. And it is going back to what your food sensitivities are, what your genetic blueprint is, your epigenetic variations. We want to understand you individually, but giving you a set of recommendations, we want to be looking more at these foods as opposed to these foods. And they correlate with how these trees look. Right? So if you have an 80-20 rule, meaning you're 80% eating whole foods on this side of the table, and 20% of the time, maybe it's holidays or getting together with friends, or you have some rituals, because those are important for connection and relationships. But it really cannot surpass 20%, or you could be feeding more of the breakdown or the dysfunction that you might have within your body. Then we kind of went over this last week too, but eating a rainbow, especially for the lymphatic system, we need to be lowering systemic inflammation. And the best way to do that is with 9 to 13 servings per day of phytonutrients. So I don't know about you, but I'm still not yet at a consistent 9. When I am home and maybe don't have anything else going on, I'm shooting for 9. But that's why I take my lifelong vitality supplements as well. Because if I can't get what my body needs on a daily basis, I'm going to supplement it. So remember those lifelong vitality supplements, which includes an antioxidant. So this is going to give you energy naturally. It's got all of the botanicals that's going to feed your mitochondria, which is the energy producing part of your cells. And it's going to help you get rid of things that your body doesn't need, basically. The vitamin, the multivitamin, has those cruciferous vegetables, has all the greens that if you're not eating leafy greens and cruciferous vegetables, those are super important for the lymphatic system and your organs for detoxification. So think about what I was telling you about that new cause of lymphedema. If you've got too many toxins and you're not eating greens and vegetables, you absolutely should be supplementing until you can make those lifestyle changes. I'll be the first to admit 5 years ago, there was no way I loved Brussels sprouts and broccoli as much as I do today. Like I crave Brussels sprouts, cauliflower, broccoli. And that's exactly what I needed with my estrogen dominance. I needed to allow those foods to help me detoxify the things that my body doesn't need. But if you're not someone who craves it, and you are on that standard American diet where you're eating a lot of to-go foods, consider supplementation full dose until you get to a point where you're starting to reintroduce these foods from the earth. The other thing about the food nutrient complex is it's got all your vitamins and minerals. So it is extremely hard, especially with our soil depleted ground, that we're even getting, even as an organic purchaser of organic foods, we often won't see the same quality in the nutrients and the minerals because of the way our soils have been over the last 20 and 30 years. So, so I like to do a full dose of this when I'm busy, like from here to December, I'll be taking a full dose. But when in the summertime, I'm much more apt to have lots more on the fruit and vegetable platter. So I may take half a dose, but I really do believe, and I didn't even know much about supplements 5 years ago, but I really do believe that having good foundational supplements is key to also keeping on target with making other lifestyle changes, because it's simple. And the last here is the omega-3, 6, and 9. So a nice blend of all the omegas that we need. So you can get this as a fish oil, or you can even get it as vegan form. But the benefit of using doTERRA's fish oil is that they have 9 essential oils that are in the capsules that will help with your immune health. So this is one of the first things I recommend when someone's going down the functional lymphedema therapy protocol. We look at foundational supplements. So at the bare minimum, just taking these 3. Then the next step is to look at a good digestive enzyme. So digestive enzymes, another supplement, I had no idea what it was 5 years ago, is we have naturally digestive enzymes in our gut, in our stomach. But when we are not able to produce them because of many things that go on in our modern world, we need to supplement with them. What do digestive enzymes do? They break down food, like, for example, that 20% of the time, or if you are someone who's eating a lot of fast food or food that's quick and go, your body, if it doesn't have enough digestive enzymes, it's going to be the start of a problem with you eliminating. So we need your body to be able to digest those tougher foods, as well as when you're eating clean, it actually helps you absorb the nutrients that you need. So the digestive enzyme, like Terrazyme, is something to use with your meals when you're eating. Okay. And then going through, cancer, I mean, this is for everybody, but because we're doing this fundraiser and related around cancer, they have 2 other products called Digest Zen Soft Gels, which is a combination of essential oils like fennel and peppermint, ginger, I think's in there. It's a combination of oils that'll help your digestive system if you're having symptoms. Okay, so nausea, upset stomach, loss of appetite. You can take this and know that it's 100% natural, and you're not now adding more synthetic medication or over-the-counter solutions that are going to add to your toxic load. So again, it's really great to have these 2. This is also another product if you're used to using Tums. It's a great alternative. But again, these should be used as needed. The Terrazyme is to be used during when you have your meals. And then of course, most people by now have heard of probiotics. And this is a really great way to sustain your healthy microbiome. The doTERRA probiotic I love because it's encapsulated with a prebiotic, and a prebiotic feeds a probiotic. And so you've got that all in one. And it's the way the delivery system is that it's not going to burn, like your stomach acid is not going to burn up a lot of those cultures. It's going to get to where it needs to get, which is the small and large intestine. So a probiotic like this is recommended, or a lot of ways you can get around. I have a few people that cannot swallow pills, or maybe that amount of pills. So know that even the kids line, the PB Assist Junior, which is just like a little pixie stick, adults can use as well. So if that's an issue for you, you can look at the PB Assist Junior. So that's a great way. We looked over eating right. So if you're someone who's working towards that 80-20 rule and really getting a lot of whole foods that cover all of the rainbow, and now you've got a basic foundational supplementation protocol. Okay, now we've fixed eating right, and I'm going to be doing that. What else can we do to help our lymphatic systems when it comes to exercise? As a physical therapist, I've always been known and taught to teach home exercise programs, but home exercise programs fail after you finish physical therapy 85% of the time. And that was a study that was done a few years ago. And why is that? Because people are bored. Not everyone likes to do a prescribed sets and weights. My husband loves that. He loves his little area in the gym. It's never been something I enjoy doing. So again, within these last 5 years, I've learned to find what people love to do. And what I mean by that is that with the lymphatic system, it's not having to do about going to the gym and lifting weights or doing my prescribed home exercise program. It's really about movement. So my favorite this year, yoga by far, but getting out and just running around with your kids or your grandkids, or going and taking a bike ride, or joining the Y and doing some pool over the winter months, or maybe you have a swimming pool and you're just walking. For lymphedema or even the lymphatics itself, being in a pool actually creates liquid compression. So when you're moving throughout the pool, it really improves lymphatic activity if you were going to pick one activity. But if you don't like the pool, you've got to look at what sparks joy. Taking a walk with the dog, even shopping. I had a 95-year-old lady who had lymphedema in her legs, and she had a 24-hour aid, and I gave her the prescribed home exercise program, and she kept coming back with continual swelling, even though she was wearing her compression garments. So it hit me that day. I said, well, what do you enjoy doing? And the aide laughed and said, oh, she loves to shop. And I said, will you take her to the mall, the Monmouth Mall, for 20 minutes, 3 times a week? And she took her walker, her eyes lit up, and she took her walker 3 times a week. Her aide took her. She came back 4 weeks later and her lymphedema was well controlled. So it really, I remember that woman and I think, wow, do we always have to be prescribing a home exercise program? No, but know that the lymphatics really improve with movement. And the reason is because the lymphatic system does not have a heart like our bloodstream does. So our heart pumps every beat. And so the veins and the arteries get movement with every heartbeat. The lymphatic system doesn't have something like the heart connected to it. But I think of all the muscles that surround everywhere you have skin as the heart muscle. We call it the active muscle pump. So as long as you're moving, if you're someone who's sedentary a lot because of your work, or because like this woman who was 95, she just sat at home. She watched TV, she enjoyed her aid, but she loved window shopping and shopping. So for her, it was to get her out for 20 minutes, 3 times a week is all it took. So really start to dive deep into what kind of activity are you doing regularly on a normal basis, to decide what you can do, what you enjoy doing, knowing it's helping your lymphatic system. So we talked about eating right, we talked about movement. Now let's talk about relieving stress. We talked about this last week, but why would stress have anything to do with your lymphatic system? Well, I will tell you, I measure it on my Sozo device. I know when people are taking on more stress and not managing it. Now, we may not be able to control what comes into our lives on a daily basis, right? But we can control how we manage those stressful moments. And when we are under stress, our fight or flight system releases more cortisol, which is a hormone that's highly inflammatory when we don't regulate it. So cortisol is healthy for us, but it's not healthy when we are not bringing it back down again. Okay. And I do a whole workshop on this. I am really in love with this topic because it's really rooted in one of the main reasons my health was declining, was because I pushed through anything that came my way. My parents taught me how to work hard and just be a good person and just push through the pain. But unfortunately, that was to my detriment because it caught up with me. And as I've been aware of that, I see how prevalent it is amongst all of us. We can all be better at managing our daily stress. And so to me, that meant going away on a vacation for a week, but it really wasn't managing my stress because when I got back, I just dumped myself right back onto that treadmill of burnout, and I didn't know how to take the daily stressors that came my way. So oils really made it super simple to pop a few oils depending on the mood or the problem or the anticipation of what was coming that day, or even reactively. Today, for example, nothing went my way this morning. I should not have been home. I would have been at the clinic. No, my son did not go to school today. He's with my mom. The internet didn't work. I mean, all of those things would have had me probably have a stress headache. You know, that normally was my response to stress is I got a headache. But I just grabbed my oils. My oils were with me and I kept breathing. And with the yoga I've been doing, I've been able to take a really nice cleansing breath and I feel great because we can't control the things around us, but we can control how we respond to them. So I go into much greater detail on how there's so many tools you can use: 4-7-8 breathing, journaling, gratitude work. Affirmations is from that book I mentioned last week, Noah St. John's Secret Code of Success. And even surrounding yourself around people like my doTERRA family is huge stress management for me. I avoid the news, but I surround myself purposely, knowing it's actually good for my health, right? And in those situations, you may not be able to avoid toxicity or bad relationships, or, you know, things out in our environment. We can then respond by using these other things. If you're interested in the stress management workshop, it's probably going to be up by the end of this month. So shoot me an email and let me know that you're interested. We really deep dive into that. And then, so now we're eating right, we're moving, we're managing our stress. And the last topic, which is going to lead into our next week's topic, is reducing toxic load. So here's my favorite thing that I put together. It might have even been 2 years ago, maybe last year. But you are what you eat, drink, breathe, and can't eliminate. So if you're eating this, drinking this, and you're not aware of your toxins around you. So if you're breathing in all of the synthetic air fresheners and candles and cleaners, and then you can't eliminate, meaning you're not detoxifying by having 2 to 3 bowel movements a day, you will have a buildup of toxins in your body. So remember last week we talked about how is your body exposed to toxins by inhaling, absorbing, and ingesting. So you've got your cleaning products, your perfume, even dryer sheets and laundry detergent. You're absorbing anything you put on your skin is absorbing into your bloodstream. Your lymphatics have to either use it or get rid of it. And then what you ingest, all of the foods and things that we're ingesting. So I love listening to this equation. So this might be the one thing that you remember after all of this that I present. Everyone has a total toxic load at the end of each day. I like to think of it daily because nobody's perfect, right? So the total toxic load of my body at the end of the day, and yours as well, equals the total toxic exposure of that day. So that means how many chemicals, toxins you inhaled, applied, or ingested. So take that amount and then subtract your ability to excrete them. So that's going to all depend on your epigenetics and your lifestyle. And interestingly enough, remember last week we talked about how your lifestyle impacts your epigenetics. So even though you might have a genetic variation, you do have control over it by controlling your lifestyle and really understanding your epigenetics. Okay. So total toxic load at the end of the day is, there are days that I say, ooh, I didn't have any sugar. I didn't, I didn't inhale. There's sometimes where I go in even to the office and I inhale synthetic perfume because I can really tell the difference. So for example, what you're inhaling, it's hard for me now because I don't apply anything on my body that's toxic, but I did. So if you take all of that, which you have control over, and then you take your ability, that's going to equal your total toxic load. Okay. So you don't want a positive, you want a negative amount. I always think of this as numbers and math. So if you can really impact how your body gets rid of the toxins while you're working on switching out your products or switching out what you do throughout your day in your own home and your own work environment, you're set. So this part we're going to talk about next week when we talk about toxin-free living. I'm going to teach you how to change out common things in your home that are extremely toxic that you may not be aware of, that I was definitely not aware of. But when I learned that, and then I learned how to improve the way the toxins that I do inhale or apply and ingest, because let's face it, we cannot control every toxin that comes within our environment. So now we want to look at how can our lymphatic system, okay, we're coming back into the lymphatic system, how can that be improved, whether you have lymphedema or not? Whether you have a normally functioning lymphatic system or one quadrant or two quadrants that are a little dysfunctional where you need to support it more, this all can be beneficial. So the easiest way, other than all the things we just talked about through all the other areas, is dry brushing. And I have to say, I was always against this. Dry brushing has been around for a long time, and people would come to me and say, oh, people with lymphedema, can I dry brush? And I was not taught dry brushing, and I had my blinders on, and I decided that that wasn't part of the protocol. So I would always say no. And then as I took my blinders off, got off the treadmill of burnout and started thinking again with my own brain, I started asking, well, what's all about this dry brushing? So I brought my dry brush. Leah, I only see you again. You can see me, right? Okay, so I've got my dry brush, and it's a soft bristled dry brush. Actually, I'll tell you the brand. I get it right off of Amazon. It's called Scala Wet and Dry Body Brush. It's, I think, $9. And this is my favorite so far because I've tried a few, and some of them are real hard. And I don't want a hard bristled brush. You want it nice and soft. And what you're going to do, the whole goal of this is to stimulate the lymphatics. So when I do manual lymph drainage, which is the superficial massage, it's extremely light on the skin. And one of the reasons I don't teach self manual lymph drainage is because there's a pressure. There are different sequences, and it takes a long time to teach someone how to do manual lymph drainage on themselves. So with dry brushing, all it is bringing the brush, we call it distal to proximal, so towards the lymph nodes or towards the heart. So you can use essential oils to even maximize the effect. My favorite right now, I do switch out, and I will show you the oils that I love for dry brushing in a minute. But my favorite right now is the Yarrow Palm serum. So the serum goes a lot longer, and it doesn't have that deep blue tinge that the straight oil has. So I just put this right on my brush. I do 2 squirts, and it has a little bit of blue. And if you're doing your arm, now this is for someone without lymphedema. If you have lymphedema, you can still do this, but I want you to talk to your lymphedema therapist or reach out to me because there are special instructions. But my lymph nodes are in my armpit. So I want to start to bring the brush towards the armpit, and you just do one stroke in all areas of that section of your arm. Then you're going to do the next section, and then the next section. And then at the end, I like to do one full sweep. At the end of this, I mean, I just did one arm in less than a minute. I automatically feel just invigorated in this side. This side feels awake. This side feels like it hasn't been paid attention to. And what's happening is, because the lymphatics are so superficial right underneath your skin, you are invigorating that lymphatic system to just start working even better. So especially for people who are sitting a lot, this is extremely helpful because you're lacking that active muscle pump. But something so quick and easy as a dry brush with essential oils can be an amazing 3-minute self-care technique that you can do. I like to do it in the morning right after my shower, but really when you're looking at it, inviting it into any self-care ritual that you have during the day can be beneficial. And then the last thing I want to go over is hydration. Do not be like myself and brag that you don't have to use the restroom when you're traveling, and think that's good. I started drinking a lot of water, and I shifted my mindset. And I always try to get my lymphedema patients to shift their mindset when they're going through treatment, because they're going to urinate a lot more. Every time you urinate, have gratitude, because when I urinate, and it might be inconvenient, I got to run to the restroom, I was working so hard, or I might be with a patient and I've got to run to the restroom 4 times a day. I thank my body for doing that, because I imagine all of the toxins that my body does not need being eliminated. But if you're not drinking water, that is not going to happen. And I notice it on the days where I might not remember to drink as much, I don't urinate as much. And that correlates with how I feel. So if you have that mindset that the more water you drink, the better you're going to detoxify and get the things out that your body doesn't need, it might be easier to visit the restroom more times, and you won't be bragging like I did many years ago. So let's deep dive into what my favorite oils are for supporting the lymphatic system. So we talked about, remember, the lymphatic system is responsible for eliminating toxins and supporting the immune system. So when you have a healthy lymphatic system or not, the lemon, the lime, any citrus oil is going to help cleanse and assist the lymphatic system in doing the detox part of its job. Okay, so choose any citrus essential oil. Lemon is really my favorite, but do not put them in your plastic water bottles. Put them in glass, stainless steel, or like a ceramic mug. Another thing you can do is make your own teas. Believe it or not, hot water and a drop or two of an essential oil, you don't even need a tea bag. You can just drink your essential oils, and it's really comforting. Maybe a little honey with the lemon. So be creative with that, but also understand why you're using it. That's for the cleansing and detox. My lymph drainage and dry brushing essential oils recommendations is expanding. I might need to start shrinking the bottles, but I'm loving lemongrass and cypress. Those are my top 2 in treatments because they have so many other functions aside from a supporting lymph movement or fluid movement of fluid. They have, like, lemongrass is a great bug repellent. It's great for pain, and they're inexpensive. These are, doTERRA oils range from $10 a bottle to $250 a bottle. And I think cypress, lemongrass, I think is 11, and cypress is less than 20 as well. So I like using those for when people are first starting out with their lymph drainage. But here you have your yarrow palm. This is not the serum. This is the actual oil that you can put within your dry brushing. Then you have grapefruit, geranium, Siberian fir, and helichrysum. The only one you have to be careful of when you're doing any type of dry brushing in the morning is grapefruit, because remember, topically, these all citrus oils are photosensitive. So if you like grapefruit and you want to use it for other things and you're going to use it with your dry brushing, you just have to be careful that you're not doing it in the morning and then going out in the sun. Decongestant. So what does this mean? This is for someone who has lymphedema or has retention of fluid, maybe. This is where your tissue just starts to feel thick. So this is mainly for people who have lymphedema, but these oils specifically will help, kind of, the way I think of it is breaking up the stagnant fluid, and then the oils, the screen before, is going to help move it into the pipes of the lymphatic system and get it out of there. So if you have a thicker fluid, these are the oils, and some of them are the same. Look, lemongrass, cypress, helichrysum. So those oils you can use for any degree of lymphedema or just for support of the lymphatic system. And then last but not least, the other function of the lymphatic system is our immune system. Okay. So almost all of my patients get introduced to On Guard or Stronger when we start talking about essential oils, because these two oils are going to support our immune system. So all of those oils are immune boosting. So when we look at On Guard, that one has cinnamon and clove and wild orange and rosemary and eucalyptus, where Stronger is a kid's blend, but it's also great if you're not a fan of either the aroma of On Guard or you just want two choices, right? So Stronger has rose, frankincense, I think litsea, and cedarwood. And then DDR Prime is another one that I love to recommend foundationally. DDR Prime is our cellular complex. So anytime you have a diagnosis, I kind of think of anytime our body's systems are going awry, I love adding a drop of DDR Prime to your normal foundational regimen. I love putting this on my kids, on the spine or on the bottom of the feet. So it stands for damaged DNA repair. So using these three oils foundationally, and then these two oils I love to have on hand, especially when we're going into these winter months. These are the two powerhouse oils to include, kind of like what we talked about when we were talking about Terrazyme and the digestive supplements. These two you might have on hand for when you start feeling off or when you need extra support. So thyme and oregano are really powerful. And Symphony of Cells, I mean, if you're a new oiler, you might want to just put this one on the back burner until you get used to learning your oils. But if you're someone who's used essential oils, know that there are many different applications called the Symphony of Cells, which is where you apply a list of essential oils on the spine and on the bottoms of the feet in a specific sequence. It only takes about 5 to 7 minutes, but this is the lymphatic application. So there is an actual order of essential oils that you can apply on the spine and the feet to support your overall lymphatic system. And those would be frankincense, and then you layer a layer of coconut oil, because there are a list of essential oils you're going to use at once. So we always dilute. We have rosemary or tea tree. Then we have the Aroma Touch blend, lemongrass, the Slim and Sassy or metabolic blend, lemon, grapefruit, ginger, and peppermint. So these get applied 2 to 3 drops on the spine and then the bottoms of the feet. You can either do it yourself or have someone else help you. So this is another thing that I like to offer patients if they would like to learn it, but it's typically something you would do within your own home. If you're someone who's struggling with your lymphedema right now, you can do it 3 times a week for 4 weeks as an acute support, or you can do it foundationally every week to every 2 weeks, one session or one application. So I'm going to wrap up with giving you some things that are going on. We just found out today is November 1st, and doTERRA announced, which doesn't happen often, that there are 20% off select enrollment kits. So my two favorites are of those. The Home Essentials kit I love. So if you don't already have oils, this is a great kit to start with. It's usually $249 for the diffuser and the top 10 oils for physical and emotional health, and now it's discounted to $199. And my other top favorite, if you're really looking to help make a shift in your nutrition and your lifestyle, you can go for the Healthy Habits kit, which has those supplements that I was talking about, plus the digestive enzyme and the probiotic, and you get those foundational essential oils as well as the deep blue rub. So reach out to the person that is invited you to this class so that you can talk to them about those kits for this month if you're a new customer. And I just wanted to thank you guys for coming to these classes. It's really exciting to be focused on a topic that is really near and dear to my heart and pretty much has been my work for the past 20 years. And so we're going to be talking about toxin-free living next, not tomorrow, but the following Tuesday, November 9th at 7 p.m. And then Leah and I are going to do some simple DIY recipes for the mind, body, and spirit on November 16th at 7 p.m. We also have our direct donation page. We have that posted everywhere. We really appreciate all the donations. Like I said, we're already at 61%. So, and then Healing Hands on November 30th is going to match all of the donations that we've collected up until that point. And I think, yes, that is it. So I'm going to stop my share. And I want to thank everyone for attending by Zoom. I'm going to stop my Wyatt Rehab Facebook Live. Thank you for watching in. Stop live stream.